Today, we are going to talk about women's heart health. What is heart disease? Heart disease is the leading cause of death for both men and women in the United States. In fact, 1 in 4 women die from heart disease. It can refer to several different types of heart conditions. The most common type is coronary artery disease, which affects the blood flow to the heart. Decreased blood flow can cause a heart attack. Some signs of a heart attack include pain or discomfort in the jaw, neck, or back, feeling weak, lightheaded, or faint, chest pain or discomfort in the arms or shoulder, and shortness of breath. Compared to men, women have more symptoms that are unrelated to chest pain. These can include neck, jaw, shoulder, upper back, or abdominal discomfort, shortness of breath, pain in one or both arms, nausea or vomiting, sweating, lightheadedness or dizziness, unusual fatigue, and indigestion. Women also tend to have blockages in both main and small arteries. This is a condition called small vessel heart disease or coronary microvascular disease. Women tend to have symptoms when resting or asleep more than men do. Emotional stress can play a role in triggering heart attack symptoms in women as well. Because many women don't associate their symptoms with heart disease, they tend to show up in emergency rooms after heart damage has already been done. Women also tend to be less diagnosed with heart disease than men because of the difference in their symptoms. Some risk factors of heart disease include high blood pressure, high cholesterol, diabetes, physical inactivity, poor nutrition, obesity, smoking, excessive alcohol intake, and mental stress and depression. What is hypertension? Hypertension occurs when the force of your blood pushing against the walls of your blood vessels is consistently too high. This chart helps you interpret blood pressure numbers. A normal blood pressure has a systolic number of less than 120 and a diastolic number of less than 80. Hypertension stage 1 is defined as having an upper number between 130 and 139 and a lower number of 80 to 89. Most of the time, hypertension does not have obvious symptoms. Certain physical traits and lifestyle choices can put you at greater risk of hypertension. When left untreated, the damage that high blood pressure does to your circulatory system is a significant contributing factor to heart attacks, strokes, and other health threats. What is diabetes? Diabetes is a disease that occurs when your blood glucose or sugar is too high. Did you know that there are 422 million people with diabetes worldwide and 29.1 million people in the United States? Diabetes is the main cause of blindness in individuals aged 20 to 74. Some symptoms of diabetes include increased thirst and urination, feeling tired, unexplained weight loss, blurred vision, and many people don't really have symptoms or don't know that they have diabetes. Some risk factors that contribute to diabetes include a family history of diabetes, being overweight, being over the age of 45, physical inactivity, and race. In order to prevent getting diabetes, you should lose weight if you are overweight, be active for at least 30 minutes most days of the week, and follow a reduced calorie eating plan. This chart explains how to interpret blood sugar numbers. What is cholesterol? Cholesterol is produced by the liver and can be found in certain foods. Your body needs cholesterol, but too much of it can cause plaques to form in your arteries and cause heart disease. There are 2 different types of cholesterol. Good cholesterol, or HDL, can protect you from heart disease, while bad cholesterol, or LDL, can increase the risk of heart disease. High levels of cholesterol can double the risk of heart disease. Adults over 20 years old should get their cholesterol levels checked every 4 to 6 years. Your cholesterol levels are affected by physical activity, diet, and genetic predisposition. What is obesity? Obesity is abnormal or excessive fat accumulation that can present a risk to our health. A measure of appropriate weight based on height is the body mass index, or BMI, shown on the right. Obesity can be harmful to our health and is a risk factor for diabetes, cardiovascular diseases, and cancer. In order to prevent obesity, it is important to maintain a healthy weight. To do so, we can limit fats, especially saturated fats and trans fats. We can increase consumption of fruits, vegetables, whole grains, and nuts. We can limit the intake of sugar and limit the intake of salt. Smoking is a very unhealthy habit, especially for our hearts. Smoking raises your blood pressure, which can increase your risk for heart attack and stroke. You can talk with your healthcare professional about ways to help you quit, or call 1-800-QUIT-NOW today. Stress and depression tend to play a larger role on women's heart health than men's. Depression makes it difficult to maintain a healthy lifestyle and follow recommended treatment. Two other risk factors include menopause and pregnancy complications. Low levels of estrogen after menopause pose a significant risk of developing diseases in the smaller blood vessels. High blood pressure or diabetes during pregnancy can increase the mother's long-term risk of high blood pressure and diabetes. Family history can also be a risk factor. It appears to be a greater risk factor in women than men. Inflammatory diseases like rheumatoid arthritis, lupus, and others can increase the risk of heart disease in both men and women. A few symptoms of a heart attack include discomfort, tightness, uncomfortable pressure, fullness, or squeezing in the center of the chest that lasts more than a few minutes or comes and goes, crushing chest pain, and also pressure or pain that spreads to the shoulders, neck, upper back, jaw, or arms. Some other symptoms include dizziness or nausea, clammy sweats, heart flutters or paleness, unexplained feelings of anxiety, fatigue or weakness, stomach or abdominal pain, and shortness of breath and difficulty breathing. Some ways to prevent a heart attack include exercising and eating healthy, making lifestyle changes such as decreasing your stress levels and avoiding tobacco and excessive alcohol, and talking to your doctor about tests such as blood pressure, diabetes, and cholesterol level exams. If you are having heart attack symptoms, you should call 911 and tell the dispatcher that you are experiencing signs and symptoms of a heart attack. Do not try to drive yourself or ask a friend to drive you to the hospital. Aside from the ability to treat and resuscitate should your condition worsen, professional emergency personnel know the proper facilities to take patients. 15 minutes in the ambulance to a more distant hospital could save hours of waiting for proper care. Take aspirin as directed by your healthcare professional. Be sure to ask them if aspirin can reduce your risk of having a heart attack or stroke, and be sure to inform them of both your family history and your own medical history. The earlier you receive treatment, the better the likelihood that damage to your heart will be kept to a minimum. Some tests and diagnostic tools that your healthcare provider may use include blood tests, chest x-rays, computer tomography, angiograms, echocardiography, electrocardiography, MRI, and stress tests. Treatment requires lifelong management. Making heart-healthy changes in your daily life remains the single most effective way to stop the disease from progressing. If you have already survived a heart attack, adopting better lifestyle habits can reduce the risk of another one. In order to prevent heart disease, commit to eating a heart-healthy diet. Limit the amount of fat and salt that you intake, and increase the amount of fresh fruits, vegetables, whole grains, fat-free or low-fat dairy products, fish, fiber, and lean poultry and meat that you consume. Regular physical activity can also improve heart function, control your weight, lower blood pressure, and cholesterol levels. It can also prevent depression and minimize stress. 30 minutes of moderate exercise daily is associated with lower death rates from heart disease. Go for a brisk walk, ride a bike, garden, or swim. It is important to watch your weight. Excess body fat forces your heart to work harder and can worsen heart disease. Shedding even a small amount of weight can make a big difference. Losing weight may reduce cardiovascular risk by controlling high blood pressure, elevated cholesterol levels, and diabetes. The best way to lose weight is through a combination of diet and exercise. Avoiding smoking is another way to prevent heart disease. Stop smoking and avoid secondhand smoke. Smoking can damage your heart and blood vessels. People who smoke are at risk of blood clots and high blood pressure. Quitting dramatically cuts the risk of heart disease. It is also important to reduce your stress levels. Learn to recognize signs of stress in your life and cope with them through meditation, yoga, or rhythmic breathing. Regular exercise is also another way to reduce stress. Here are some important tips to follow. Set realistic goals and map out a plan that you can follow. Make one change at a time. Know that there will be good days and bad days, so don't beat yourself up or overdo it. Share your goals with family and friends so that they can support you. To learn more, you can visit this link. Thank you for watching.